everyone, and welcome. I'm Heather Holmes with KTVU Fox 2 News here in the San Francisco Bay Area. And joining me once again is Dr. Rashid Sotani. He is medical officer at IEM and someone that we've been talking to now for several months regarding the coronavirus. Thank you so much, Doctor, for being here once again.
Thank you for having me to talk about this very important subject that is affecting the country in a very adverse way right now.
Yeah, and Doctor, right now, a lot of people's attention is on the presidential race, but the coronavirus is something that we can't forget about. I mean, the numbers continue to trend in really the wrong direction.
You're absolutely right. And like 2 weeks ago when we were talking, unfortunately, I had also predicted that we would have about 100,000 cases by election day. And guess what? We have exceeded the number of cases, 100,000 cases yesterday. 103,087 cases were recorded yesterday, which is a 25% increase over the past week. Unfortunately, the testing has not really gone up. So these are real cases. Testing has only gone up 4.25%. So we're definitely not moving in the right direction. This is the first time across the world that a country has had 100,000 new cases with 52,000 new hospitalizations yesterday and over 1,000 deaths yesterday, which is again a 24% increase from 4 weeks ago.
And what do you make of the increases that we're seeing? What do you attribute those to?
Well, we always said that, the numbers are going to go up. We expected the numbers to go up in the fall, and they have gone up. Right now, 16 states are hit really bad with a record number of hospitalizations. We've El Paso that had over 1,041 hospitalizations yesterday, and they had to stand up 4 mobile morgues over there, which is really heartbreaking to even think about. The reason that we've had these cases and the number of cases going up, we expected that during the second wave, when everybody's indoors, and obviously a lot of people had not were taking they let down their guard because we honestly have COVID fatigue. We are tired of this disease, but the numbers because of the infections now moving to the rural areas. More infections in younger people because some of the schools open, some of the early openings, and I am for opening the economy, but in a very, very, very tight and a strict way. These numbers are going to go up. We've not really reached the peak of this second wave, which is the third surge of coronavirus in our nation, and it is still going to go up, and it is going to be just devastating by Christmas because, a lot of people are not going to have their family members with them for dinner during the holidays.
Yeah, that is such a sobering thought for so many people. Doctor, though, when you think about the increase, what do you think might be the correct response right now to what we're seeing?
Well, the correct response is the same that we had. We have 2 different things that we have to think about. We have to think about the medicinal response and the non-medicinal response. So we are on track of developing vaccines. We have developed some therapeutics. Some of them are working, some of them are not working as well as we expected. But we are moving very, very close to getting a vaccine out. Most of the states have been told to receive the first vaccine batches by November 15th. I don't know if that's going to happen because we still don't have the FDA approval, emergency authorization approval, or any of the vaccines, although there are 4 candidates, at least 3 candidates that are the front runners that expect to get their vaccine out soon. So right now, what do we need? We need to make sure that we are wearing the mask, we are observing social distancing, and we are doing hand hygiene. We have nothing, unfortunately, at this particular point. Yes, if you're hospitalized, and I don't want you to be hospitalized, there are things that are being done in the hospitals because we've learned how to deal with this disease. So our mortality, fortunately, has declined a little bit compared to the number of cases. But for the general population, there's no drug that is available. There's no vaccine that is out as yet. So you got to make sure that you are using the common sense measures to protect yourselves, your family, your neighborhood, in the entire country, we all have to unite on this thing. And if we do that, I can assure you our number of cases can be controlled. They will still go up, but we can control them. Without it, they will just skyrocket.
Yeah, we have to really all work together on this. Doctor, you mentioned a vaccine. Obviously, work is continuing, hoping to make some progress. But what do you make of how this vaccine might eventually be distributed? And do you think there is an appropriate plan in place?
Well, in terms of the vaccine, one of the things that everybody should understand and appreciate that the threshold of the effectiveness of the vaccine is 50%. So no vaccine so far. There are no vaccine. There's just a couple vaccines, specifically one vaccine that is 95, 97% efficacious, measles vaccine, but no vaccine is 100% efficacious. So even if you get the vaccine, it doesn't mean that you're not going to get the disease or you're completely protected against the disease. Only 50% of the people will be protected against the disease. Our intention is that, 70%, at some point, 70% of the population of the United States, that's about 229 million people that get the vaccine. And then, obviously there are X number of people, maybe 10% of the population that already has contracted the disease and has recovered, and somehow build the herd immunity to a point that 70% of the people are protected from the disease. Now, what does that mean? If 70% of the people are protected from the disease, what it means is that if I have either had the vaccine and I'm in that lucky group that is the 50% where the vaccine is working in my body and I'm developing the antibodies, or I have developed the disease, or now I'm immune to the disease. If I come in contact with another individual who has the disease, I won't get the disease and I won't pass the disease to the next person. So you break that chain, and that is what we want to do, but it is going to take a long time to do it. Now, the other big problem that we have is I just mentioned 229 million people that have to be vaccinated across the nation.
Right.
We know that there are, there are two vaccines that are the front runners that require refrigeration to a point that, sometimes it's not possible, -70, -30, whatever it is. It is, that's serious. You cannot break the cold chain. If you break the cold chain, what happens is that the effectiveness of the vaccine disappears. So it has to be transported under very strict conditions. Then it has to be put in some place without too much interference in moving it from the truck or the plane or wherever. So it's going to be flown in. Then a truck which has the right refrigeration picks it up and takes it to a point which has the right refrigeration where it is, secured. And then you have to monitor the temperature constantly to make sure that the efficacy or the effectiveness of the vaccine doesn't go down. So this is not a trivial task. Now, some of the states are equipped with some of this stuff. Some of the states are not equipped with some of this stuff. We do not have a federal response for vaccine distribution and administration. We need that desperately, because each state going their own way might not be, the most effective thing to do at this point.
And so what might a federal response, a federal plan look like in your opinion?
A federal plan would make sure that there is equitable distribution of vaccine to all the different states, number one. Number two, it would look like the provisions or the resources are provided to states where they do not have the resources for storing the vaccine. Then it has to be decided through a federal response how and who are the people that are going to be the priority people who are going to get the vaccine. We've talked about the priority already. We've talked about first line defenders, medical professionals, nursing homes, and that discussion has gone on. But a recent study has come out, and it makes some sense. Who are the people who are getting most of this disease? Young folks are getting the disease. They're spreading it to the older folks. And now what's happening is that, the young folks do not have to go to the hospital, usually do not get adverse disease. So like flu, perhaps we have to come up with a strategy that we take the young group first and then their parents. At the same time, we are taking care of the healthcare workers and the first line defenders and perhaps nursing homes. But we have to come up with a plan, and we have to come up with a strategy how we are going to do all of this thing. as a nation, not individual states, because then, one state might get something, the other state might not, and one state might be operating under different standard operating procedures, other might be operating under different. And what we need is to make sure that our entire nation is fighting against this virus as one unit.
Yeah, that's something that we'll be waiting to hear from. Obviously, right now, though, all the attention is on the outcome of the presidential election. But hopefully, in the coming weeks, if not sooner, we'll hear more about how the federal government plans to distribute a vaccine. All of us keeping our fingers crossed that that's sooner rather than later. Dr. Chotani, we are just about out of time. I know that you like to leave the audience with a final thought. What might that be today?
Well, one of the things that has come to light, and a lot of people are talking about it, is that we are going to have another problem with the supply of N95 masks.
Mm.
Hospitals are starting to ration those masks. So, with all the numbers going up, everything going up, what I want everybody to do is to once more, and I keep repeating this thing, wear a mask, make sure you're keeping the social distance, and make sure that you're hand washing. I know it's difficult, especially during this time. And believe me, it is as difficult on you as it is on me and my family. And what we have to do is to make sure that, we are protecting ourselves and everybody else around us. That is the only weapon that we have against COVID at this particular point. And let's use that to make sure that, we can decrease the number of deaths and the number of cases in our nation. Thank you.
Yeah. Such simple measures, but they can make a big difference. Dr. Chotani, really appreciate it. Thank you so much.
My pleasure, and look forward to seeing you again.
Thank you.